Magandang araw po. Ako po si Nelly Beth Mercado. Currently, I'm the Regional Program Coordinator at Regional Program Management Office of Field Office Calabarzon. I used to handle gender mainstreaming at the National Program Management Office from 2015 until 2020. Before finally joining the region to handle program operations. My work at NPMO was gender mainstreaming, which also handled the development of case management standards for the program. This morning, I'll be discussing session 2, which is part of module 1 and which is all about Kilos-Unlad overview, which means that I'll walk you through how we journeyed towards developing the Kilos-Unlad as the 7-year case management strategy of Pantawid program. And second, I'll be discussing the Kilos-Unlad as a case management approach and strategy. And lastly, I'll be discussing about the Kilos-Unlad phases, components and activities. And as I said, this is just going to be an overview and the details will be tackled all throughout the e-learning program. For the first part of my presentation, I will take you back to the journey that we took in developing the Kilos-Unlad as a 7-year case management approach and strategy for the program. When we were doing gender mainstreaming for the program, we engage a lot of program stakeholders, particularly our household beneficiaries, our parent leaders, our field staff. And through several conversations, we started asking questions, hanggang saan ba natin tutulungan ang ating mahihirap na mga beneficiaries at saan natin sila dadalhin, hanggang saan sila pwedeng tulungan ng programa. And so those years of engaging through conversations with several program stakeholders, we finally sat down together with my team, and of course particularly in August 2019, after drawing from our experience in gender mainstreaming, we sat down as a team and we brainstormed on the case management process. During that time also, kakapasa ng 4-piece law, which stipulates the program is expected to work with the beneficiaries within a timeline of 7 years. So within 7 years, anong dapat at ano ang gusto nating makita together with our program households. After we brainstormed, we immediately sat down with Pantawid Mancom and presented what we then call the Pantawid Pamilya Social Service and Development Framework, which basically asks the question of where do we bring the Pantawid households within a 7-year timeline. The first draft was based on a generalist social case management approach using different methods in engaging households for case management. So, as you can see, that's the visual representation of the first draft. And then after that, between September to December 2019, we found several opportunities to present the enhanced framework to several workshops with participants coming from different regions who are technical staff of the program, and of course partners from CSOs and other government agencies, and even from different OBS of central office. And during the time, we were able to improve on a great deal on the contents of the framework. So as you can see, that's the visual representation of the improved framework which we used when we were given several opportunities to present to a series of consultations. An important part of our consultation process was our engagements and conversations with our international development partners, in particular ADB and, of course, UNICEF, who contributed a great deal in enhancing the framework. And after that, when we entered 2020, we decided to identify, of course together with the principals, to identify prospective members of the Kilos-Unlad Technical Working Group coming from Critical Ops at DSWD Central Office. And then after that, the version na bit-bit namin when we entered March until April 2020, ito na yung pinagbasehan namin ng guidance notes and case management tools to be used by our field workers in establishing helping relationship with our beneficiaries. There were about 20 case management tools and 7 sub-tools that were developed as references for our field workers. So that was March to April, and as we all know, during that time, we were on pandemic and we were immobilized and paralyzed to handle face-to-face trainings. So, from May to June, the GAD team converted the training design into an e-learning program. And at the same time, the KU guidance notes and the case management tools were finalized. And also within June, the guidance notes for the pilot implementation of Kilos-Unlad was approved by our principals. Lastly, papasadahan natin isa-isa ang Kilos-Unlad phases, components, and activities under each component. Kanina nakita natin yung sitwasyon ng ating mga households. And most of them, we assume, are at the survival level. Now, Kilos-Unlad is all about helping them change the situation where we found them, where the program found them as poor or as households who are in difficult situation. Kilos-Unlad will bring them to a better state, and that better state is self-sufficiency or improved level of well-being. So I'll walk you through the components. Kilos-Unlad has 5 components set within a 7-year timeline. The first one is enroll. In enrollment, of course, we do registration. And based on the law, it's through a standard and objective household targeting, which is basically listahan. The second component is assess and analyze. Under this component are 2 particular activities. First is the determination of the level of well-being using the social welfare and development indicators. And second is assessment of conditions and needs or risks and vulnerabilities of the individuals, families, and communities. First, on the determination of the level of well-being, as we all know, SWIDI is done in waves. We've had 2 waves already of SWIDI. But with Kilos-Unlad, we are pushing that the SWIDI be done at intake. After registering the household, we immediately administer SWIDI. So we no longer do the SWIDI waves and the massive administration of SWIDI and looking for budget. Every time that we register households, immediately we assess them using the SWIDI. And because SWIDI determines specifically the level of well-being of the households, in particular, indicators related to social adequacy and economic sufficiency, we saw the need to also assess the conditions, the needs, the risks and vulnerabilities of even the individual family members or the families and even communities. So what happens is that this particular activity will tell us who are the solo parents, who have disabilities, or who even are experiencing gender-based violence, who are the households having great exposure to potential hazards, during disasters and calamities. So this particular activity will tell us that, and this would come along with the SWIDI. Okay, so that's assess and analyze. Now for the next, we have agreement setting. This is the third component, and under this component are two major activities. The first is family or community visioning. After administering the SWIDI and the family risk and vulnerability assessment, the worker, using the KU approach and strategy, will sit down with families, present to the family their situation, and then will facilitate some sort of visioning with them. Where do you want to go as a family, as a household? If the worker works with a particular community, the community members will be gathered into a visioning exercise. Where do you want to go? What do you want to happen to your community? After setting the vision, the worker will now move on to participatory intervention planning. We have here what we call the household intervention plan. So the household intervention plan, or the HIP, will be formulated in a participatory fashion. The important point here is that there has to be an intervention plan. And another important point is that it's done in a participatory manner. After having the intervention plan, we now move on to the fourth component. The fourth component has two activities. One is integrated delivery of social development programs by the social service workforce, and the second is referrals. Taking off from the previous component, the family or the community, they already have intervention plans, no? So what will happen now, the worker will explore the social service workforce. So the convergence context is an important element of this activity. So at present, we have the convergence action teams, right? We have the municipal action teams. And within this context, the worker should be able to help realize, together with the household and the community, the contents of the intervention plan. And this can be referred to the different programs and services offered by the members of the social service workforce. So these two activities are well integrated or well connected, and they happen simultaneously, no? It doesn't necessarily mean that one has to happen first before the other. Then the next component is transition. Under transition, there are three activities. We have networking and conversion complementation of services, and then transition assessment, graduation, and exiting. So kanina nakita natin kung papaano natutugunan ang mga pangangailangan ng isang household or community para makamtan nila ang improved level of well-being. And of course, DSWD cannot do it alone. That's why it's important to network and converge with available services. So ito, tutugunan niya, i-realize niya kung may pangangailangan for livelihood, for supply side, at kung ano-ano pang mga pangangailangan na makikita in the previous components, dito ito matutugunan. And then, makikita rin sa transition yung katanungan na, is this particular household ready to transition? So, an important activity is to assess whether that particular household or that particular community is ready to transition. There's a tool developed to assess the readiness of the household or the community towards graduation or exit. This is the time to say goodbye from the program and be transported to another phase of their lives as households and as communities. So dito rin makikita yung paano ba nagiging epektibo yung programa sa pakikipagtrabaho sa Pantawid households at sa Pantawid communities. So dito rin makikita kung magsi-celebrate na ba tayo for graduation ng mga nasabing households and communities. And after transition, we're expected to disengage as a program because per assessment, we will be able to see the following indicators. We have a stable source of income and other family resource. Posibleng nakabuild na sila ng asset, no? Dahil doon sa iba't ibang intervention, iba't ibang serbisyo at programa na natamo noong mga households and communities. And then there's already a graduate because Pantawid is all about education and health. So of course, an important indicator is there's already a graduate in the family. And that member has employable and productive skills already and has some level of wealth and assets. And of course, they enjoy basic amenities. And they no longer have critical vulnerabilities. So, na-overcome na nila kung anumang vulnerabilities meron sila because they've been capacitated to do that. And of course, an important indicator is that the households are involved in community groups as part of the aftercare. Hindi naman sila magdi-disengage or hindi ibig sabihin na wala na sila sa programa ay forever goodbye na. Importante na bahagi pa rin sila ng isang grupo sa komunidad na nagpapatuloy ang pagtutulungan nila bilang isang grupo at isang importanteng mover sa loob ng isang lokalidad. So, as you can see, this is actually the Kilos-Unlad framework. In summary, it's important that in all of the components, there's monitoring and evaluation. And of course, at the very base or at the very foundation of this framework are the household beneficiaries, the LGUs as important partner where all of these activities would take place. Of course, DSWD and our partner agencies, particularly government agencies and CSOs or non-government organizations. In a nutshell, Kilos-Unlad as 7-year framework will allow the program through its workers to help shepherd Pantawid family households to achieve improved well-being so that they will step up and out of poverty. Lastly, I'd like to remind everyone that Kilos-Unlad as a case management approach would require so much from us as helpers because purposively we'd like to see changes in the lives of the households and the communities that we're helping. Every now and then, we have to be reminded that the most important tool in this process is ourself. So we use the self as the number one tool in helping. So what do we mean by this? When we use ourselves as the tool, we have to be self-aware. Self-awareness is the capacity to confront the self. Every now and then, look in the mirror, ask ourselves, what have we done so far that has been helpful? Ano yung ginagawa natin na epektibo? Ano yung posibleng mga biases pa at mga harmful stereotypes, expectations na meron tayo as a worker na hindi nakakatulong sa mga tinutulungan natin at sa mga katrabaho natin ng mga households at mga komunidad. Dahil could be draining, no, yung pagtulong. Imagine if you're a worker handling 800 cases. So that's really consuming. So baka mawala yung sarili natin in the process. So importante talaga na binabalikan natin yung ating core bilang bilang worker ng DSWD at bilang catalyst for change. And that ends our session 2 of Module 1. Sana po ay may natutunan tayo. Maraming salamat.
P